Hi everyone, today we're going to be talking about toothpaste. Now, one of the most common questions that we receive is, which toothpaste is best for me? Or which toothpaste should I buy? Now, generally the answer back is, especially for someone that doesn't have any problems with their teeth, is, just buy something that tastes good, that is the right price, and you like the texture of. Generally most toothpaste have fluoride in it, and they generally do a very similar job. Now, the main ingredients in most toothpaste are fluoride and slight abrasive particles to kind of clean your teeth, and it has a few additives like sweeteners and stabilizers to kind of hold everything together and make it taste good. Now, so if you just need regular toothpaste, one of the leaders in the market is Colgate Total, and I would highly recommend that one. But again, it just depends what you like the flavor of and kind of your pricing point. Now, if you have sensitive teeth, especially coming into winter, the water's cold, the air's cold, then you've got two main competitors on the market. So that's Sensodyne and Colgate Sensitive. Now, they both work in different mechanisms, but they do a very similar job. So some people will find a bigger benefit using the Colgate and some with Sensodyne. So I generally say to my patients, try both. You've got to use them for at least 1 to 2 weeks to get the full effect, and then see which one works best for you. Now, if the symptoms persist and you haven't been to the dentist for a while, you should get your teeth checked. Double check it's not decay or something else that's going on in the mouth, and they're great. Now, if you have a high risk of tooth decay, or even with sensitive teeth as well, the other option is using Colgate's Nutriflor 5000. Now, this is 5 times the concentration of normal toothpaste, which is 5 times the amount of fluoride in the toothpaste, and that helps really strengthen the enamel and reverse the decay if it's very shallow in the superficial surface. So this is a great product, especially for those that have lots of fillings to protect the teeth. Now, we generally have people coming in that may have gum disease. So we'd recommend them a toothpaste called Puricet that's made in Sweden. The main ingredient here is chlorhexidine. So this is a great product for people that have gum disease and that get lots of gum inflammation. This will help kill the bacteria and reduce all that inflammation. But again, this should be prescribed by your dentist to make sure it's suitable for you. Now, regarding children's toothpaste, they kind of come in stages. You can get like 2 to 6, which is this one particular brand is by Pixters. The concentration of fluoride is lower. You can get 6 plus, so that's kind of like 6 to 12 years of age. Again, it's kind of a moderate amount of fluoride, and then you go up to adults, which are about 1,000 parts per million. This will probably be about 600 or 800, and this will be a little bit lower than that. It's all very much about marketing on the toothpaste. Most of them do the same job. Now, the last option in terms of toothpaste would be whitening toothpaste. Now, I definitely wouldn't recommend whitening toothpaste. The way they work is through abrasion, by taking your top layer off your teeth. So, which is fine, the first micron layer to kind of get them a little bit white, but if you do it every day, eventually that micron layer will be quite big and you've actually worn away your enamel, which then can make your teeth more sensitive, as well as cause recession of the gums or dig into your teeth. So generally stay away from whitening, and if you want to whiten your teeth, the best way to do it is through the bleaching material that we're able to give you at the dentist. That doesn't damage your teeth as long as they're used carefully, and that'll be a much better outcome than spending a lot of money on these toothpastes, which generally don't work very well. So coming back to the original question, which toothpaste is best for me? Generally, just if you have no issues at all, just pick the toothpaste that works, that tastes and costs within your budget. But if your dentist has recommended something else, then definitely stick to that. Or if you just have sensitive teeth, then you can just pick up some Sensodyne or Colgate Sensitive off the shelf. If you have any questions, please leave a comment below and we'll get back to you as soon as possible. Thank you.